Hi, I'm Dr. Mary Gregory with Uptown Eye Care in Monticello, Minnesota. I wanted to talk a little bit today about myopia control. Myopia is the term we use to mean nearsightedness. So typically babies are born a little bit farsighted. As we're developing our vision, we slowly outgrow the farsightedness, which means sighted for far, a little tougher for near, but generally by the age of 5 or 6, we've outgrown that. Hopefully we're at 0 prescription. So perfect vision, eyes are seeing far away, and we're able to zoom in and see up close well. Well, not all of us are fortunate enough to stay there. Some people do, but as we continue to grow, sometimes the eye keeps growing or stretching out in the back, and then we become nearsighted. Nearsighted children and adults can see near okay without their glasses, but require prescription glasses or contacts to see far away. That used to be and has always been an issue, but is becoming more and more an issue as time goes on. In fact, the World Health Organization is now estimating that by the year 2050, 50% of the world's population, are going to be nearsighted. So there's been a lot of research across industries around the world for the last few decades, really looking at this and what can we do to slow this down or prevent it. We've had some theories and ideas in the past, but it turns out some of this research has shown that some of the things we were thinking really weren't true. So right now, really starting in about 2020, we've had some FDA-approved ways that we can slow down the progression of the nearsightedness. The reason we want to do this is not only do we not want our kids growing up requiring glasses and having that disability of not being able to see without corrective lenses, but as that eye continues to grow longer, it really sets us up for a much higher risk. An extremely higher risk, in fact, for many serious eye diseases as well and conditions. So we want to, for many reasons, keep our kids in the smallest prescription once they become nearsighted. Right now in the United States, in 2023 here, we have an option when children are young to use a certain type of a drop in a very low strength of what's called atropine. And we use that drop to help keep the eye from stretching. So pros and cons, kids, of course, don't like eye drops, but kids at 4, 5, 6, 7 sometimes aren't ready to be put into the next option, which is probably the most common that we fit in our practice, which are contact lenses. Primarily, there are 2 types of contacts that we're using for myopia control. One is called MySight by CooperVision, and that was FDA approved in March of 2020 to reduce the amount of nearsightedness by about 50% growth or change. And that's been very effective. The other type of, the MySight is actually a 1-day throwaway contact lens, but it's important that you're wearing it every day to get the full benefit. The second type of contact lens is called Ortho-K or orthokeratology lenses. These are more, if you think of like retainers after you've had braces that you wear overnight to keep your teeth in alignment. Ortho-K is using a type of a retainer contact in your eyes at night. So you put them in before you go to bed. They help to mold or reshape the front of your eye, your cornea, to then not need the contacts to see during the day. This is what I have my daughter in. She's active and in sports and doesn't want the hassle of the contacts. And so she is putting these contacts in at night. She takes them out in the morning. Her vision is great all day. The next night, she pops them back in again. So lots of benefits to that as well. I wanted to show you just a little bit on the eyeball and what we really believe is happening in the increase in nearsightedness. We know that what research has really indicated is a lack of outdoor time. So we know kids aren't spending as much time outdoors as they used to. And in fact, one large study showed that kids who spent at least 9 hours of outdoor time before they were 12 years old every week had a greatly reduced risk of becoming nearsighted or that prescription changing as quickly. So it's not even a lot of time, but we think sunlight and spaces without walls and borders and constriction Really great for our eyes and, of course, our body and mental health and lots of things. But so that was one area that we can work on, is just getting our kids outside to play a little bit more often. The second is just the increase in screen time, and really, frankly, all near time. Our world and culture really is focused on things within arm's reach now, and we know that that's also a factor in the increased incidence of nearsightedness. So if we go to the photo here, I have just a drawing of an eye. This little tiny spot here in the back of the eye is where the center of your vision is. What we know is if the eye is this perfect shape or size, length, we call this axial length, the length from the front to the back of the eye. We now have instrument in our office to measure that axial length, so we can get a baseline on all of the kiddos coming in, and then we can continue to map and measure that as time goes on. Some people, especially with just certain genetics, and then those other risk factors, the back of the eyeball continues to stretch. So when you come in and you're needing a pair of glasses, we're putting glasses on the front of your eye, which focuses all of the light to the back of the eye, but also in a straight line here that matches the glasses prescription here. What we know is that this causes the rest of the area out here to be a little blurry. And so part of the theory is that that blurry part is also stretching to get to where the glasses prescription is giving clarity. As that stretches this part out, it's also pushing this part further back. So it's a continual process as we're getting stronger and stronger prescription. The newer technologies in other countries, Europe and Asia and Canada, they have now approved glasses, which we do not have in the United States yet. They're not FDA approved. We're hoping in the next year, sometime we'll have that option as well. And what the goal of those glasses is to essentially curve or better match more of the back of the eye with the prescription to stop that stimulation to grow or stretch. The two kinds of contacts that I talked about, the MySight or the retainer contacts, the Ortho-K, both reshape or also change the optics of the back of the eye to better correct it for more clarity across a broader range of the back of the retina, to again decrease the risk or indication for that to continue to grow. So those are options that we have in our office. You can certainly jump online or give us a call or schedule an appointment if that's a concern for you. We can discuss the different options anytime at your eye exam too.